People with chronic neck and back pain oftentimes end up in my office, chiropractic office, physical therapy, acupuncture, massage, naturopath, meditation, whatever it might be. If the problem lasts for a long time and people try certain medical things, sometimes it works, sometimes it doesn't, they might present in an office like mine. We see a lot of it. The number one thing we see in a chiropractic office is low back pain. Number two is neck. Then we're dealing with headaches and chronic headaches and migraines and so forth. So these chronic pain conditions end up in our offices, and that's why I want to talk about neuroplasticity and patience. Patience meaning giving it time, meaning it's going to be a longer haul, and we have to work on that. That's part of it. So when we have acute pain, which is part of what we deal with in an office like mine as well, typically it's like a sprained ankle. And most sprained ankles are going to get better. And they're going to get better in a fairly predictable period of time. If it's mild, it might be a couple of weeks, and if it's moderate, it's a few weeks. A more significant sprain is a few months and so forth. But same thing with necks and backs. You can usually handle that scenario, that flare-up, whatever might be going on. Somebody traveled and their lower back is bothering them, or they slept funny and their neck hurts and they're coming like this. These things are easy to handle. So that's acute pain. But we're talking about chronic pain, something that's been around for years or even decades. So neuroplasticity weaves its way into what we try to do in a chiropractic office with patients. And I oftentimes will tell people this. Half of pain is pain, the pain itself, dealing with the pain that you have and the limitations of your life. The other half of pain is patience. Having patience that we're going to dig in our heels, we're going to do the work, we're going to come in from different angles and try to solve the problem, hopefully a little bit, hopefully a lot, maybe fully, but we go after it. When people present to me often with chronic neck and back pain, they've oftentimes tried a lot of other things, and it's almost like chiropractic is that last resort, right? So they come in, and we do the history, and we take the information, we say, what triggered this? If we know, maybe we do, maybe we don't. And then what seems to make it worse, what's better, what's the pattern, and so on and so forth. Okay, what have you tried in the past? And then I try to come in with my philosophy is, what can we do differently? Things that we have to do different. If X, Y, and Z did not give them any result or only temporary result, let's go with A, B, and C. Let's try some different things and see what we can come up with. Neuroplasticity means that the nervous system is plastic. Neuro, nerve, plasticity, plastic, moldable, changeable, not set in stone, something that you can change over time. And our brains will always remain plastic and changeable throughout our lives. We can be 90 years old and learn a new language because we're going to change neuroplastic connections in our brain that's going to take this new information and lay down some memory. Okay? It's going to take us probably a little longer to learn a language when we're 90 as opposed to when we're 2. But nevertheless, the nervous system stays plastic, so we can do that. Well, there's neuroplasticity in chronic pain. So let's say somebody's lower back is bothering them for 30 years, and they had a bad injury when they were 20, and now they're 50, and it hurts all the time and bugs them when they do this. If they sit too long, it hurts. If they lift too many things, it hurts. Certain workouts hurt, whatever. Activity might bother them. Certain things they have to limit and so forth. So it's this chronic nag, and it manipulates your life and so on and so forth. Very common stuff, unfortunately. Okay. So when somebody comes in, I don't explain this all in one visit, but I wanted to just give you a snapshot of how this works so you can appreciate what we're trying to do. As the pain information is coming from the lower back and then going upstairs, and remember, even though you think you feel pain in your back, actually it's being registered in your brain. The brain is where you're feeling everything, okay? So the pain traffic continues to come usually from irritated discs in your lower back, and it keeps on sending the messages. Let's say 24/7, 365, all the time. Just sending those messages, pain, I hurt, pain, I hurt, pain, I hurt. Through neuroplasticity, the nervous system does not discriminate. It's going to set up a superhighway of pathways from the back to the brain, back to the brain, back and forth like this. It's going to open up those channels, lay down new roads, so it's really easy for you to perceive pain in your lower back. It just gets better and better at it all the time. Like learning new music, like learning a new language. The more you do it, the better those pathways get. Well, unfortunately with pain, the same thing. The better that pathway gets. Bummer. So when somebody comes in, they've got this superhighway of information from the back to the brain that's transmitting pain. Eventually I'll explain that to them. And then I'll say, well, you've got this public works department on your nervous system. And this public works department will continue to change the roadways on the nervous system in your spinal cord and in your brain and make changes in there. And it can tear down the old pathways that we might not want and put in some new roadways, okay? So what we do with the care in the office is understanding these principles of neuroplasticity. We try to change the information going from the back to the brain. So I'll use vibration techniques, I'll use chiropractic instruments, I will use specific stretches and exercises and so forth. So I'll take this information to try to change the nerve endings that are being stimulated in the back and the pathways to the brain. And if we do that on a consistent basis, eventually over time, we're going to remold those highways. It's going to change from a pain superhighway to a I'm feeling better, this is more normal superhighway. But that can take time. And I've talked about that a lot of the patients that have come in to see me in the past. I talked about a woman, Gail, in her 70s. She had chronic low back pain, couldn't work, had to take early retirement, kind of had to lay around most of the day. And I worked on her, and it took us about 3 years, to a point where my back is terrible, I don't want to live anymore, to I have a happy back. And we're still maintaining her to this day several years later. My patient John, we talked about him on the program in the past, chronic low back pain, changed his life, couldn't be a musician anymore, had to go back to school, couldn't sit in school, uncomfortable, eventually made his way to my office. It took us 2 years to go from a chronic back problem really messing up his life to 20 years later, after the 2 years of fixing him, now 20 years later, he's enjoying a great life. He's back to music, he's more fit than he's ever been, and so forth, really enjoying his life. And he gets to choose what he wants to do. He doesn't have to be constrained by this chronic lower back problem, okay? So that's a couple of examples of how we use the principles of neuroplasticity to make changes over time. Now, the particular person coming in with chronic low back pain, I'll say, let's give it 2 or 3 years to see where you're going to be. I can't say that to somebody in the beginning, although I will, over time, introduce them to the fact that this could take a long time. So these are examples of adults that it did take 2 or 3 years to make those changes and make those neuroplasticity changes on the nervous system, trying to change the signals. As I'm doing my chiropractic work, my tables and adjustments and instruments and so forth, what I tell people is it's very similar to hot water coming out of your faucet. The water coming out of the faucet is, ow, too hot, can't use it, too hot, scalding, hurts, painful. So what do we do with that hot water? We turn on a little bit of cold that mixes with the hot and then makes it feel comfortable, okay? Pain is hot water. All the other techniques and tools and instruments that I use is cold water. When you go to acupuncture or receive massage or go to physical therapy or receive some sort of therapy machine, whether it be ultrasound or muscle stimulation or my React table or neurostim or whatever it might be, even biofeedback methods and so forth, what these are doing is dumping a bunch of cold water on your nervous system to shut down the pain pathways and begin to change that pain superhighway, tear those roadways down so you get a chance to heal. As we move along with neuroplasticity, and I have somebody in chronic pain, and let's say they've been like that for years, they'll say, my pain is X each day, and I wake up and I'm stiff, and it's a 4/10, and then at the end of the day, it's a 6/10. And I work on it for a few weeks. Let's say I'm just making this story up right now, and they say, you know, I don't notice any change yet. Still about a 4 in the morning and about a 6 at the end of the day. 3 or 4 weeks in, they say, you know what, over the weekend, I actually, at the end of the day, I was more like a 5. I noticed that I wasn't quite as achy and stiff and miserable at the end of the day. I'm like, bam. So I focus on that and I said, when's the last time you've actually been a 5 at the end of the day? They're like, I can't remember, it's been a long time. Great. What that's showing us is you can now be a 5 instead of a 6. Like, oh yeah, that's pretty cool. So I've got some patient stories just in the past couple of days. I had a young man who injured his back, his lower back, in a car accident. It's been many, many months now. It wasn't getting any better, ended up in my office. And I've been working on him about a month now, and he said, just had the best day that I've had yet. On Saturday it was a 1, and usually it's a 3. I'm like, awesome. Now you can be at least as good as a 1. They're like, oh yeah, that's right. Hey, that's great. Even though he didn't stay there, at least now he's showing himself and showing me that he can be at least that good. Another woman I'm thinking of right now, she's in her 70s. She's had off and on backaches, hip problems, leg trouble, and so forth. She just told me on a weekend day, she said, all day long, no pain. She also has knee stiffness. She said, my knees were fine, my back was good. I'm like, boom. Now again, she didn't stay that way. The next day she had some stiffness and aches, but at least again, she showed herself and also showed me that she had a pain-free day. So then we capitalize on that and we talk about it, and I say the changes are beginning to happen, so your body is now demonstrating that it can be at least in lower pain, if not no pain. Then we harp on the patient's part of it. Okay, I said, so this is taking time, and if I could get you better in 1 visit, I would do that. It's beyond my pay grade, but I would do that. And then, of course, the line to see me would be out the door and down the street, right? Because everybody knows, hey, if you get chronic pain, you just go see Fuller, and you get better in 1 visit, and you're good to go. It just doesn't work that way. So we use these principles of neuroplasticity and patience to make a change. So I have a bunch of tools that I use in my office that might be different than other practitioners. And we've talked about that many times in this program. I know when it's pain, and particularly chronic pain, we might not get the best benefit just with chiropractic care. So then I'll start expanding the tools in the toolbox to see if somebody's interested in making those changes. We know that nutrition habits affect pain. We know that general physical exercise, if that's available to that person, if they can do that, will affect their pain or how quickly they get better. We know that chronic stress issues definitely affects pain. And by the way, I think that is an unsung hero, meaning conquering stress would be the unsung hero on dealing with people with chronic pain problems, migraine, headaches, neck pain, low back pain, whatever it might be. We'll be spending more time in some future programs on dealing with that. Okay? So there's that stress component. Then we get into anti-inflammatory supplements, and pretty much everybody's in agreement, we need some omega-3s from fish. We need some vitamin D. Magnesium's probably a good idea. Antioxidants. Now there's lots of other supplements that we can get into I won't talk about now. But we target ourselves in some anti-inflammatory supplements. We talk about water. We talk about sleep patterns. All of these things can have improvements if we employ these tools on a chronic pain patient. So I take all these tools out and I see if somebody's interested. If we see a little bit of a change, then I'll come in and say, hey, what about this? Hey, well, let's try this one. Are you interested in taking some supplements? What's your sleep look like? And then we start getting into that, and then I send them to this show, and I said, we've got a lot of this on the shows that are available to you. Okay. So if they notice a little bit of change in a chronic pain pattern, hopefully in a short period of time, even if it's a tiny bit, then I'll say, let's continue with this. The longer we do it, and then I'll talk to them, I'll mention them. I have them written out on handouts, or I'll send them to one of my videos, and I'll say, look at these patients like Gail, like John, like these other people that saw a little bit of change in the beginning when nothing else worked, and they're like, hey, at least I have some change, I'm gonna keep going. I'm gonna go another month. Oh my gosh, I'm another 5% better. I'm gonna go another month. Well, I'm another 3% better, whatever the number is, right? And they start making these inroads. Neuroplasticity is the avenue, as we start explaining it, to making those changes. We start teaching the body that it doesn't have to be in this chronic pain, hopefully, that they can make those changes and make them long-term, and then working on the patients, having patients that hopefully with these new tools, we can make a change and get your life back. I'm Dr. Scott Fuller.